September 11th and Hurricane Katrina, two of our nation's most recent and most devastating disasters, revealed our vulnerability to the unknown and opened our eyes to the importance of being prepared. Here in Missouri, a powerful F3 tornado leveled part of the town of Caruthersville, and explosive storms and tornadoes severed power to 700,000 in St. Louis for days during a blistering heat wave. Let's face it, emergencies can happen anytime, anywhere, and being equipped can make all the difference. This rings true especially for businesses like yours that have the added responsibility of caring for others. And never will that care matter more than in the face of a real emergency. So, exactly how prepared are you? There's no way of knowing what type of crisis might happen or when it will strike, but there are 3 easy steps that will help you take control of any tragic situation, from a terrorist attack to a tornado. First, create a plan for your facility, your employees, and the people in your care. Second, prepare an emergency kit. And third, listen for information about what to do and where to go during an actual emergency. The program is called Ready in 3, and it will help you and your staff be ready for anything. The first step in emergency preparedness is to create a plan. Missouri licensing requires that you have an emergency plan for fires and tornadoes. But what exactly should your plan entail? Well, your emergency plan simply spells out what steps you will take and what steps you will teach your staff and residents to take in a crisis situation. No one else can write your plan for you because every facility in the state is unique. Let's hear how a few of your peers are ensuring the safety of their staff and clientele.
I think it's very important to be prepared. We're taking care of people's lives. It's just imagine if your mom was here. And what would you expect me to do as her responsible party?
What's important and challenging is the fact that a lot of people that are within long-term care institutions have a cognitive impairment.
We do fire drills so often they all just know as soon as that fire alarm goes off, they're out the door. It's very important and very good for that to be a routine thing for them, that they're so used to doing this that they won't even think twice if it really does happen.
We got to practice the drill a lot more frequently than we do in other places. And the reason why I say that is because the staff turnover rate in long-term care facilities is very high. So ensuring everybody is on that same page is important.
We have a sign-in sheet that as everyone walks into the building, they sign in for the day. And so one of the first things that one of our staff will do before they leave the building is to grab that sign-in sheet so that we can account for everyone once they get outside the building.
One of the men here at the house, he is hard of hearing. He also has beginning stages of Alzheimer's and has developmental disabilities. So one of the challenges with him is with the drills, him knowing what we're doing. Tornado drills will show him a picture of a tornado so that he knows what we're talking about, and then we can show him where he would go. One of the other things he has is a bed shaker in case he is sleeping and he wouldn't hear the alarm. Then if he's in bed, it would shake and he knows that's part of the alarm. He knows you have to get outside.
The challenges are mobility. With canes, with walkers, some with wheelchairs, that they're not going to be able to move as quickly.
Everyone before they left, we had name tags on everybody and on wheelchairs, on jerry chairs, and charts obviously are labeled. Their pictures are in all their charts.
So we have faced problems with evacuations in the past when people were moved from, say New Orleans here to Missouri and had nothing with them. They were not aware of what medications they were on. They did not know what their diagnosis was. We tried to develop a system wherein we can have the medical information with the patient at the time of transition. Even the drug list that the nurse is carrying with her might be something that we can send with the patient when they transition. Security doesn't mean, just having them, in a place where we know they're away from the disaster or the zone of danger, but at the same time ensuring the security of their treatments, which will ensure how well they do and how well they feel.
To create your own emergency plan, start by placing someone in charge of coordinating preparedness planning. Larger facilities may even assemble a committee. If this is your job, you should begin by thinking about the space around you and how you would react to possible crisis. Consider emergencies that could occur within your facility. Then consider what could happen in your community. Think about how your staff and residents could handle a power outage, even one that lasts for days or even weeks. If your facility's critical information is computerized, do you have an uninterruptible power supply unit and a battery backup system that kicks in if you lose electricity? And how about if you lose your plumbing and your water supply? You probably already have medical information and emergency contacts for every person in your care, but this is a good time to double check. And where is that information kept? It is crucial that this information reside not only within your facility, but it also needs to be accessible in case of an evacuation. It's suggested that you keep this information handy on cards or documents listing participants' full names, family contact information, birth dates, physicians, food and drug allergies, and information regarding any necessary medications or conditions.
We have people change day by day. We have people that go out to the hospital. We have people that are admitted every day, and it changes constantly. So what we're going to be implementing is to print our emergency contact list every week so that in case of an emergency, we have something that we can have at our fingertips every week that is absolutely accurate.
Along with your patient emergency information, you will need facility contact information for administrators and staff, as well as numbers for your local and state health department contacts, utilities, and points of contact for local hospitals. And be sure to update this at least twice a year to keep it current.